Hi, my name is Candace. My son attempted to take his life December 10th, and that's why I'm here. My concerns are not about social media in particular. I think that is definitely something interesting to think about. However, public health is something that I think we need to pay more attention to. I feel like we're putting a lot of onus on these children where we're not, as adults, we're not giving them the best models of behavior. And I think that's something that we all need to look in the mirror and focus on as well. I also think it's very important to think about privilege. A lot of the things that you all have mentioned are things that a lot of kids, particularly in Pittsburgh, do not have access to.
100%.
And that is something that we cannot ignore. And that's part of the public health crisis. And in fact, I wish that we had focused a little bit more on what the crisis means for this particular community and what's being done to help these kids, because I'm living it with my 14-year-old. And I have had very little support from the medical community, from the social worker community, and that's not on them. I think it's the systems that are broken. So what are the systems? How are they failing us? And what can we do to advocate for better systems, for better understanding, and for equity in these systems? And so that's something that I'm really...
Yeah. I think that's like 100% something that we should be doing. And I'm sorry that you went through that with your child. Unfortunately, there are currently less and less resources available, which is why we're so grateful for organizations like Saunton Farm that are hosting events like this. One example I can give you, in our adolescent medicine division, we've received some funding from the federal government for a program called ET3, which is Empowering Teens to Thrive. So it's teens who have experienced violence in the community, either to themselves or been witness to that violence, are paired with natural mentors from their community who can help them with navigating day to day. And I've had patients who have had their own mental health concerns, have had a lot of difficulty dealing with the violence in the community, in trying to navigate transitioning from their home to young adulthood. And their mentor that they've had is a supportive adult that they've been able to pair through this program. And they've had social workers who've been paid for by this program who wouldn't be paid for otherwise by the mental health care system or the medical system, but because we had these special funds. And then that mentor was able to, and their social worker was able to keep them connected over the years, so that I've seen some really positive supports. So we do need programming, and we do need to advocate for funding at the state level for things like you're speaking to.
I know there are a lot of programs, because I've been told about these programs after I qualified for them with my child.
Right.
And
it needs to be prevented.
They're the people who have shared these programs with me are not people who are directly in the care of my child.
Right.
So that's not something that doesn't make sense.
Yeah.
It doesn't make sense at all. And in fact, I've put together a list of things that I want to be able to share with other parents in case they are experiencing the same thing. And I know there are a lot more parents that are experiencing this than we know about. But a little bit of an anecdote. But my child, and this is a bit traumatic, so brace yourself, but my child did look up on ChatGPT how much of a certain pill he needed to take before he took his life. And ChatGPT gave all of the correct resources and encouraged him not to. So that's one of the, I know that's not true with a lot of kids. We read about it all the time, right? So there's something holding on to hope in that way. I don't know if the AI will continue to train in that way, but something to think about.
Thank you so much for sharing your story and being an advocate. It's important for all of us in this community. So I just wanted to thank you for that. I also, in your growing list of resources you're maybe putting together, wanted to highlight the work of the American Foundation for Suicide Prevention, which they have an advocacy arm. They advocate exactly for things just like this. They advocate legislatively, but they also do a whole lot of work in the community, which includes free programs that can be done in schools and other spots in the community that are geared towards suicide prevention. They're evidence-based as well. They have some that are directly targeted toward teens, for high schools, and for others too. The group that we have here in Western Pennsylvania is one of the best in the country. Obviously, I'm biased, but they're just a wonderful source of community belongingness. They have survivor events. They also connect with the center that I work in, which is Services for Teens at Risk, the STAR Center. We offer treatment, but and also connection to survivors of suicide that they can get together and have some group discussion and support too. So there are a lot of opportunities, I think, that we need to do much, much better than what we're currently doing.
As a society, we've had to really focus on some of the amazing foundations and nonprofits that we have as our main resources. And you're right, a lot of us on the ground don't agree that those are the only places we should have. We should have, I believe, universal health care and access to these things to have prevention. But unfortunately, the model is such that someone has to have something happen before they can get what they need.
It's so frustrating. This is a reality that I've faced with in my personal life as well, seeing young people who, because they're not qualified as or diagnosed as a certain, like you mentioned, like the tip of the iceberg,
Right.
then they get nothing. They get no
Right.
support, so psychosis is then just walking around. And that is a very frustrating reality. And I just want to call out too that, I've been sitting here as a journalist being like, oh, here, but I also feel really grateful for your presence and for sharing, and also thinking there is a role for media in this, to extend as much, to do as much enterprise storytelling as we can about the solutions that our community has to offer. And so I'm walking away with that. So thank you for being here.